Well, at the time, there was no service line. There was no HVI. It was a concept, and it was a time when we were looking to take advantage of the fact that we had very skilled physicians, but we did not have a structure in which we could participate together in a collaborative way. In 2007 is when we started the service line, and we had a team of people work together. I mean, it literally was embryonic. So people like Eric Pfeiffer, who was a chief medical officer at the time, and myself, the original executive director, the first one was Vera Gupi. We flew around, we visited other programs, saw what they were doing and how they ran, and came back and tried to figure out how it would work here.
And we actually started out with the heart failure programs with our first clinical nurse specialist, Evelyn Taverna. And my goodness, this was 15 years ago? It was a long time ago.
And it's grown into now a community-wide organization with a lot of incredible facets to it. Specifically, it has all the registries, so we know the quality of care is good. But even more importantly, without Camino Health, what's the continuum of care?
Before HVI, we were a great community hospital, delivering great care locally, one physician to one patient. Now, 15 years later of HVI, we're a really destination, highly advanced team cardiovascular program for our community that delivers really the most advanced, most technologically sound, data-driven care to our patients locally in a community hospital.
If you look back from where we are now, where we're 3-star rated in most of the cardiac surgery disciplines that the various programs, national programs rate, we're a very highly rated program, and we're a very highly rated interventional program. And of course that takes organizational infrastructure, and that's what HVI has provided.
The biggest achievement, I think, is to pull in all the different aspects of cardiology. So we have the heart failure program, but there's also the structural heart and also the surgical services. But all these are brought under one umbrella, and I think that's really a major accomplishment of HVI. So instead of having all these services siloed, it's very interdisciplinary, and it's also very collegial and data-driven. The crown jewel of my experience here has been the establishment of the Women's Heart Center, and we are the first Women's Heart Center in a non-academic center in the Bay Area.
The first part of my experience with HVI and the biggest success was really heart attack care. The second big program over the last 10 to 12 years has been the structural heart program. So this is really cutting edge, new technology to help patients that really didn't have an option for aortic valve and mitral valve and diseases where they were not surgical candidates. If you look at one of the real great stories of the HVI is a device called the MitraClip, which is transcatheter mitral valve edge-to-edge repairs. That device was actually developed here by one of our colleagues, Fred St. Gore, and we were able to be in the clinical trials that were international clinical trials. We were the only site in the Bay Area to be in that trial, which allowed our patients to get that technology. And we partnered with our research institute, the Taft Center, and participated in multi-center trials that allowed patients in our community to get the most advanced technology that's patient-cared and data-driven, and put us as a leader in really the Bay Area in this kind of field.
In many ways, cardiac imaging is the cornerstone of our modern technologies for cardiology care. It allows us to see what the problem is, which is really the fundamental first step in deciding what we can do. So every procedure we do at some level requires excellent cardiac imaging. So we are really dependent on echo, CT, MRI, all of these different technologies.
We do a lot of complex valve surgery and complex aortic surgery. And it requires a kind of diligence, a special form of hard work. We did the second TAVR it's called a core valve in the United States, but just to get that done so quickly. And now we've done, I don't know how many, but a very large number.
My name is Carol Pollard. My heart disease specialist found that I was going to the ER room a lot, couldn't breathe, and it was the valve. Dr. Ramahan here. He was going to do a mitral valve clip. I was only here a day and a half for the surgery, but the care was phenomenal. Getting involved with the cardiac rehab is what really pulled me in. When I started with the rehab, I would work out with them. Now I'm halfway through it, and I work out here really hard, and then I go home and I go shopping, and I can carry most of my grocery bags in by myself, but it's huge change for me personally.
Honestly, the biggest lesson learned for me being involved at the Heart and Vascular Institute is the importance of teamwork. The importance of really noticing what everybody's doing to make everything work well together.
A group like this, an institute like this, is only as good as the people involved, and we have the best team that we could ever hope for.
Fostering a team, the team we had in HVI, and the various subspecial programs that we had. It was great. Frankly, it was like an extended family. These were people who not only respected each other for their medical skills or administrative skills, but enjoyed each other and had affection for each other, and I think that was special.
I also want to emphasize that the administrative team in HVI at every level, from the nurses to the administrative staff, have been critical in allowing us to participate in high-level clinical trials, maintaining quality metrics at the hospital, and in many ways they allow us and give us the resources we need to be able to help patients with all of these advanced procedures.
So the incredibly generous contribution of Norma and Jack Melchor to HVI really established it as a long-standing, really productive institute. Specifically, it gave us the resources to grow to be, as I said earlier, a continuum of care for the community, and has really increased the quality that we can offer.
So the reason that my grandparents felt so strongly about supporting the Heart and Vascular Institute is it's such an important part of this hospital, and it's a field that touches almost everyone in the community. It's a field that's advanced technologically over the last 20 years more than any other field in medicine, in my opinion. And the work that we're doing here saves lives.
And that's what makes El Camino so special, is they have this vision that we can improve healthcare, we can innovate, we can make it better, and we can have an impact not only locally, but also globally, which is a mitral clip is a great example. We've now taken care of over 150,000 patients with a mitral clip, and so it just is a wonderful example of El Camino reaching out and touching the world.
I would say, in terms of the things that I look back on and that I'm proud of, is the team building that we did.
The reason why our results are so good is because everybody who's involved in this knows what they're doing and gives a great performance. To do that requires a very special team of people, and happily, we have it here.
The main thing is to realize that HVI is a real team of people, right? And that's the thing that you have to recognize, that it's the clinical nurse specialists, the data analysts, the administrative support. All of these people form a team. They're all really integral in providing this excellent patient care. And that's what I just want to make sure everybody knows and remembers.
Wow, words aren't enough. Thank you. Grateful. I just want to tell the care team how much they have meant to me and now my quality of life. I can breathe again, and I really wasn't able to breathe for quite a while. So it's changed the quality of my life. And what more can you ask? There aren't many times in your life you can have an experience in an institution like this and feel that way, and that's how I feel.